All right. You're all welcome to the IMANI REVEALS show. This is where we speak, we are real so that we can live. As usual, I would like to say a word of prayer before we proceed. We are grateful unto you, our Father, for bringing us together. Today we are talking about why some men and women are infertile. You're the one who made our bodies. And when you did, you said it was good. So we know that it's your will that everybody should be able to procreate. But for one reason or another, some are unable to do so. And today, we are trusting you to speak to us, speak through our guest, and show us what you would have us do. So that according to your will, um, each person will have the offspring that you've ordained for them. We pray for those who are yet to join us that you remind them and bring them so that we all have this fruitful discussion. We thank you in Jesus' name. Amen. Okay, so
Amen.
as always, if you haven't subscribed, please go to your browser, just type in the IMANI REVEALS show, and it will take you to the channel. You subscribe, and then you also share with anyone you think will benefit from our discussions. Today we have Dr. Derek Amoateng, and he's come to talk to us or lead the discussion on why some men and women are infertile. He's an obstetrician gynecologist and fertility specialist. He's also the treasurer for the Fertility Society of Ghana. So we can trust that he has all the apport and the info that we need to be able to manage whatever challenges that any of us may be having in terms of fertility. So I'll just hand over to him at this point. Maybe he'll say a bit more about himself, and then he'll proceed with the conversation. So Dr. Martin, please go ahead.
Okay. Thank you very much, Abby. I hope I can be heard loud and clear.
Yes.
Beautiful. So, thank you very much for having me, and a very good evening to all of your viewers. Yeah, just as you mentioned, my name is Amoateng Derek. I am a gynecologist, obstetrician gynecologist, with special interest in infertility management. I have a passion to advocate for fertility, advocate for women especially, but when it comes to reproductive health, and especially in the area of infertility. I have come across many women from, or many couples, and especially women from various diverse backgrounds, with who suffer infertility, and it's I mean, the sights of what they have to go through on a daily basis can be so disheartening,
Mm.
and can be so touching when people tell you the story, the very things they have to do in the name of fertility. And I'm sure as we go along, we can share a few of the stories. And so it's something I think everyone should come on deck. I mean, it's now a global health problem
Mm.
that everybody must come together so that we can see how best we can support couples to be able to procreate. Because I believe that it is a right of every couple to at least have a child of their own if they choose to. And so, whatever we can do to support, if it even means adoption, we try our best to help these couples attain their desire. So, it's a good discussion. I'm happy about it. And then we want to offer whatever we can to ensure that our viewers are enlightened as much as possible.
Great. So yes, you can go ahead and tell us what is infertility. What does it mean? Um, Maybe you can start from the whole reproductive system, um, the ideal situation. okay for
Okay.
a man and a
Okay.
woman?
Okay. So for pregnancy to happen, you actually need sperms and you need eggs. And for that to happen, normally you would have a man and a woman, a man with sperms that are of certain proven quality, and then a woman with structures that favor reproduction, for them to meet for procreation, for conception to happen. Normally, what will happen is that um, you need the sperms of certain minimum quality deposited in the vagina at the right time. And by the right time, it has to be on or around the time when the woman is releasing eggs. That's what we call ovulation.
Yeah.
And the sperm should be able to swim through the vagina, go through all the boisterous, um, I mean, all the pressure and all the opposition that happens in the vagina and especially in the cervix, with a very thick opposing wall called the mucus plug, as well as some hostile environment within the cervix. It should be able to traverse all of that and get into the womb, which is called the endometrial cavity. It must get in there. And from there, it should be able to find a very tiny one of two tiny spores, which we call the um, tubal, or yeah, the that's the entry point or the exit point of the fallopian tubes. So
Okay.
you should be able to find those points to be able to enter the lumen of the fallopian tube. At the same time, you're supposed to be able to ovulate, and the fimbria or the end of the fallopian tube should be able to catch the oocyte or the egg.
Okay.
And the eggs be able to move into the tube. So once that happens, you have the sperms coming in from one section, and then the egg also coming in from the other end. The two must be able to meet in the middle somewhere within the tube. And once they meet, they must, I mean, like a man meets woman, sperm meets egg. There must be some union there where the sperm then enters the egg. Once the sperm enters the egg, it gives signal to stop every other sperm from entry. And it's a very
Okay.
beautiful scenario. I mean, the way God did it. Once
Yeah.
one sperm enters, because if two sperms enter, that is an anomaly and it doesn't work out. So once one sperm is able to enter, there are signals and all that is given to the case or the wall of the egg, and it shuts every other door so that we do not have other sperms from entry. It then goes into the cell or the nucleus of the egg, and then it fertilizes it. So by fertilization, what happens is that the genetic material of the sperms mixes with the genetic material of the eggs. And then in the end, one beautiful entity is created. And that beautiful entity then continues to divide and grow. At the same time, it starts then moving from the tube until it reaches the inside of the womb, which we call the endometrium. If it is unable to reach there and it gets stuck in the tube, that's when we say you have gotten ectopic pregnancy. But for
Okay.
most pregnancies, most normal pregnancies, you would have that beautiful dividing entity, which we call the zygote, later on becoming the embryo.
Okay.
Then there are certain hormones and chemicals that encourage the growth of the embryo. And then, so it stays inside the womb and then it continues to grow until after about 40 weeks. 40 weeks from the beginning, then the baby comes out as a full grown baby. And so that is the natural phenomenon. When anything deviates from this, then it affects your ability to conceive. And I'm sure when we get to the causes, I will explain further. So basically, when we talk about infertility, what we mean by infertility is that you have a couple who haven't lived together or haven't had unprotected sex, regular unprotected sex. And by regular, most people will talk about 2 to 3 times in a week. Regular
Okay.
unprotected sex for a year, continuously for a year without getting pregnant. Then we say you have infertility. But for those who are aged 35 years and above, we tend to use 6 months instead of 1 year. The reason I will explain as we go along, because those who are advanced in age, their follicular reserve or their egg reserve is low. So it is important that we lower the threshold so that we can intervene early enough to ensure that they get the necessary help. So infertility is basically when you have a couple who have had unprotected, regular unprotected sex for 1 year and have not been unable to conceive, or 6 months if you are aged 35 years and above.
Okay. So you talked about um, the age of a woman and it being the determinant of the number of eggs. Um, at this point, the question is: so how does that? I don't know whether correlate is the word with her
In,
fertility or
if
infertility, and then with a man too.
Okay.
What are the indicators that will say that okay,
Okay.
they are
Okay.
infertile?
So as we get to what the causes are, one of the most significant factors that correlate with conception is age.
Mm.
Your
Okay.
ability to conceive. One of the most important factors is age, and especially age of the woman. Of course, in recent times, some time back, we thought to ask for a man, you can get pregnant anytime. But now we are realizing that even with men, as you age, your fertility declines, especially towards the 40s, after 35, towards the 40s, into your 50s, your fertility decline. It doesn't mean you
I
cannot
see.
conceive, impregnate a woman, but your fertility declines. But that is not
Sorry, before you go
as
on,
strong.
what does that mean? Does that mean their sperm count goes down? How do you mean by their fertility
Okay.
declines?
Okay, so yes, when it comes to their sperm counts, usually the count goes down, the motility reduces, the risk of getting
Oh,
abnormal sperms also increase. And so it's not just women that have problem with age, men also have. It's just that for men, it delays a little more than that for women. Okay.
okay.
Now, the fertility and age for women is a lot more important because this is the scenario. Women are born with a fixed number of eggs. There is a finite number of eggs that every woman is born with. So let's say by the time you reach puberty, you have about 400,000 eggs. And so what
Okay.
happens is usually when you are in the womb, you may have up to about 4 million, and then by the time you are born, maybe about a million thereabout. By the time you hit puberty, you just have about 400,000, just raw figure eggs that are left. Now, every month, what happens is the body recruits a number. It could usually be in their hundreds, or yes, I mean, up to, you can go all the way even up to about 100 of them, or sometimes less, but definitely depending on the person, you may recruit quite a number. And then once these numbers are recruited, they then go on to grow, and then only one of them end up as a dominant egg that will hatch and then be able to, or ovulate and then be able to conceive. The rest then die off. So every
Okay.
month this process go on, and you are not replacing it. So it gets to a point the bucket, which was almost full, is now almost empty. And so that is how come the age of a woman is very important, because the eggs are finite in number, and it is important that as you age, you are careful that you don't unduly prolong fertility. We realize also that especially after 37, well, from the age of 35 on, and even especially after 37, the attrition rate for the egg increases astronomically. It's let's say, assuming you were losing 50 a month, by the time you hit 35 and into 37 and above, you tend to then go on to lose 70, 80. So you tend to lose a lot more as you age. And so very quickly you lose all your eggs, or most of the good quality eggs. Apart from the numbers, you realize that as you age, the quality of the eggs also reduce. The quality of the eggs. So you may even have eggs, but these eggs are more likely to cause abnormal children, Down syndrome, Pater syndrome, Duet syndrome, and all the other aneuploidies. Or you can actually have, because their quality is not good, they may have difficulty, even if they are there, to be able to conceive. And so age is a very important factor when it comes to women, and of course men as well.
Okay. Yes. So now we can talk a bit more on the causes of
Beautiful.
infertility.
Beautiful. So the causes of infertility are derived from the very things I spoke about when it comes to the in the I mean the mood, or the way by which pregnancy happens, the mood by which pregnancy happens, and so we can look at them from that angle. But before we even go on, just for you to know, you need to understand that fertility is influenced equally, if not more, by men as it is by women. Every now and then we tend to think, oh, it is the women who are at fault. So the women will come, I want to make sure I'm fine. Oh, my husband, there's nothing wrong. My husband. But truth is, there's a recent paper we did here in Ghana in one of the facilities, and we analyzed the causes of infertility. And we found as much as 72% of the factors were as a result of some contribution from male.
Wow.
Yeah.
Yeah,
Yeah.
serious.
It says, yeah, I'm serious.
72%.
As much as 72% were found to have some contribution by men. So it's important. When you look at the statistics generally, about 40 to 50% is almost wholly a male factor. And yeah, and so it's important that we do not underrate the influence of the male factor, and then just concentrate on the females. Good. Now let's look at the causes. So the causes could be a male factor problem. So let me just start with that. Male factor problem could be maybe the man is unable to ejaculate. So there are some people, they may be able to rise up all right, but when they have sex, they ejaculate. We call it retrograde ejaculation. The sperm or the semen go back instead of coming forward through the penis. So it may go into the bladder or something. So they usually may have a dry ejaculate, for instance. You may feel relieved, but still you realize that there is no sperm there. That's one option. There could also be what we call azoospermia, where you may ejaculate, but within the semen there is no sperm. There are also what we call the oligospermia, or there are so many, the low sperm counts. You could also have problems with the movement,
Hello? Hello? Sorry, looks like he's gone off again. Hopefully he'll come back soon. But so far it's been an interesting conversation, and it's interesting to note that 72% of the, how do I say it, infertility cases as a result of some issues with men. We all know that in our society, and probably because it's the woman who carries the child, most of the time the eyes go to the woman. Dr. Amoateng, are you back? Okay, he's still out. So I hope that as we listen, there will be a paradigm shift for all of us, that our approach to this topic will be right, so that we'll tackle it in the way it should be on both sides, and take some of the burden and the pressure of women. Okay, looks like he's still off.
Online. Just a second. So what? We can give. Then, in addition, you can also have not just problem with the sperm or ejaculation, but you can actually have problems with erection. Some people are not able to erect enough to be able to penetrate, and that is also a problem. Those with very severe form of premature ejaculation may also have problems with fertility. And I remember one case I had where a couple married for 2 years plus, almost 3 years, came in to see me trying to conceive. I went to examine the woman, and her hymen was still intact. But they said they have, because the man is unable to
Hold back.
erect long enough to be able to penetrate the wife, and that was a big issue. And so we try to help around. So these are all possibilities that can. Then we will look at which other factors. When it comes to female or the male, the female factors, we can have uterine factor where you have problems with the uterus. It could be maybe there are fibroids within the uterus, there are polyps in the endometrium, there are other problems. You can also have diseases of the cervix of the woman. You could have tubal factor, and tubal factor is very important, especially in our sub-region. Infections, and it is one of the important factors we consider when it comes to prevention of infertility. Infections like gonorrhea, chlamydia, and so, and it has to do with sexual lifestyle. I mean,
Okay.
early having sex too early, multiple sexual partners, having sex with high risk people without the use of condoms, and these are all risks that can actually give you infections that will block your tubes. Then we also have things about ovulation where you are not able to release an egg. It's what we call anovulation. Diseases like hypothyroidism, or diseases like PCOS. I'm sure you've heard. That's a whole discussion for another day. We also have things like um, having high prolactin. So these are all hormone imbalance that can affect your ability to release an egg, and then ultimately may be able to affect your ability to get pregnant. Of course, there are other factors which we do not know. And you can have a combination of these factors. It could be one, or it's not just one or the other, but it could be one and the other, or even more. A mixture of multiple female factors and a male factor, or vice versa. And then one thing
Okay.
we also realize has to do with the coitus. There are a lot of couples who may not be having sex at the right time. And I told you, as I explained, if you're not having sex around the time of ovulation, normally the eggs will not last more than 24 hours. Most of the time, just within 24 hours, it's off. So if you're able to have sex, let's say a few hours prior to the release of the egg, then the sperms will be able to catch it. But
Okay.
if you miss that timing, then it is difficult to be able to conceive. So what we do is to encourage that roughly for couples trying to conceive, you should have sex about 3 times in a week, well spaced out. And most people, you should be able to catch the timing.
Okay. Can you touch a bit on the ovulation bit? I know that most women are supposed to know this, but I also know that there are some who are not really aware. So, talk a bit about the menstrual cycle and at which point the ovulation takes place.
Okay, so if I'm talking about the menstrual cycle, I would typically use a 28-day cycle as a proxy, just
Okay.
as an example. It varies from person to person, but assuming normally you have, let's say, a 28-day cycle, it doesn't mean 28-day is the only correct one. You can have a normal 30-day, 32-day, 24-day, but it is okay. It's just that you should know your cycle and work with it. Now, for a 28-day cycle, so it will begin from the first day of your flow. Some people may spot a couple of days before the real flow. We will count from when the flow itself is not so much of the spotting. Yeah, so from the first day of your flow, and then from the first few days, what the body does is that it's, as you bleed, it is recruiting the eggs I told you, and the eggs continue to grow until usually by around day 14, 15, when the eggs are matured and then they hatch. So that is where you call ovulation, where
Okay.
the eggs then break from its shell and then it is caught by the tube and then it grows. Now, when you ovulate, normally for most women, there are several factors that may show. One is to be able to have the timeline, to be able to pick up ovulation. You need to know your timing. So if I know that my cycle is about 28 days, typically you will ovulate about 14 days to your next menses.
Okay.
14 days to your next menses, not necessarily 14 days from your last menses, but 14 days to your next menses. So which we call the luteal phase. It's fairly fixed, 14 days usually. And so if you have a 28-day cycle, then it means around day 14, 15, you are likely to ovulate. If you have a 30-day cycle, around day 16, thereabout, you are likely to ovulate. So that is the first thing you should know. The second thing is that some people may have a little slight increase in body temperature, may get a little breast tenderness, may get a little pain around their flanks in their lower abdomen. These are all possible signs that may help you. And if you realize it's always around that time you expect to ovulate. Then additionally, your cervical, you may have a lot more vaginal secretion. This time, the excretion is clear and is very sticky. So if you hold it in between two fingers like this, it's really very stretchy. It's very stretchy. And so all of that may show as a sign that you would have ovulated.
Okay. Okay. Thank you. I think you are going to talk about something else
Okay,
before I
so
interrupted.
yes, yes. And of course, so once ovulation then happens, then you go to the second half of which we call the luteal phase. And that is usually 14 days. If pregnancy does not happen, then a new menses starts and then it goes on. And so there, I think we've gone through the courses. We've mentioned the fact that there are also some diseases like thyroid disease, like what we call prolactin, hyperprolactinoma, in which we find in the brain that could also affect your ability to conceive. Yes, I was going to talk about timing of coitus. There are couples that
Okay.
may be living together but may not be having sex. But even if they do, not having it adequately. Every now and then, just yesterday I had a couple, one lives all the way in Sefi also, and the other one lives in Accra. So I don't know if Sefi also, it takes probably 8 hours or more to get there. So I was asking them, maybe when you are about ovulating, maybe you should meet in Takoradi or somewhere in Kumasi. And then deposit what you have to deposit so you can continue. But it's a real problem, yeah, when you have couples living apart, or especially for those whose partners are living abroad. They come for only 2 weeks, 3 weeks, 4 weeks. So if you miss the timing, then unfortunately you would miss it. One point I should also note, you get commonly get couples asking, "Oh, we have sex rightly. We've checked. There's nothing wrong, and we had it right on time at the time we expected to ovulate. In fact, we had sex every day of the month, and still we did not get pregnant. How come?" Okay, one of the things you need to know is that the human reproductive system is not that efficient. When you have pigs get pregnant, a pig get pregnant, it can deliver up to 20, 14, 12, 15, and then even more. But the human because their structure, but a lot of them don't survive because their structure is a lot more efficient the way it runs. But ours is not like that, and it's been done purposely, for a reason. And so it's important that you give yourself time, because when you have a couple without any problem at all, for 6 months, 6 months, just about 60 80%, 60% will be able to get pregnant. For 1 year, only about 86 thereabout
Okay.
percent will be able to get pregnant, even though there may be nothing wrong with them in a year. And so you will need to know that the system is not that efficient, and that you should give it time when necessary. There is one category of cause which you should note also, that we call it unexplained infertility, and it usually forms about 10% of the case. By unexplained infertility means that your doctor has done everything, searched, done all the investigations, but we are unable to tell the cause, and still you are unable to get pregnant. So that's why we call unexplained infertility. There are also ways to handle those ones as well.
Okay. And I guess we'll go straight to how to manage. Is it possible to prevent, first of all, infertility?
Okay.
Yeah.
Okay. Usually we talk about prevention after we've done everything, but I would bring it in. Yes, I think infertility, um, shall I call it, well, I wouldn't say it's a choice, but infertility to a large extent, in a lot of ways, can be prevented. And one of the ways you can prevent infertility is lifestyle. One, first and most important, like I said, especially for us in this part of Africa, gonorrhea, syphilis, chlamydia, especially chlamydia, is very subtle in the background, but it's very dangerous. It is very common. Tuberculosis used to be a big issue, but it's no longer as big as it used to be some time ago. But it's still also relevant. Yeah. So you want to avoid infections, especially sexually transmitted infections, and these infections become a lot more problematic if you have them very early in life.
Okay.
Those who start having sex 14, 15, 16, the cervix is not that well developed. And so you are more likely to have the infections track through the cervix, get into the pelvis, and then it blocks the tubes. And so we will always encourage that you want to abstain for as long as possible. But if you have to, then you would want to use a condom. You would want to use a condom, of course. That is a way to protect yourself. So that is one. The other problem we are seeing now has to do with, because I told you that the egg reserve reduces, or the egg attrition increases with age for the women especially. You see a lot of people, they are involved in so many things. And now we have a lot of career women, which is good, which we encourage. But you get to 38, 39, 40, you are now starting to really think about childbirth. And usually by that time, most of the good ones are already gone. And so your chances of getting pregnant reduces. And one way you can prevent that is actually egg banking.
Okay.
We have, fortunately, in the system now, we have egg freezing services, and you can electively freeze your eggs. So maybe I'm 35, I don't see any partner in mind, or I am a very busy career woman. I want to get to the top of my banking job or something before I think about conception. You can choose to electively freeze your eggs. And so if you freeze the eggs at 30 and you use them at 40, the eggs will almost be as good as 30 when you use them at 40. And so egg freezing is one of the things that are, yeah, of course, if you can conceive early, get married early and conceive early, it is always better. I'm encouraging our mothers. Yes, she's 19, I understand. She's 22 and she's gotten pregnant. Let her deliver. Let her deliver. Two wrongs do not make her right. Let her deliver. See how you can support her to be able to move on with her life afterward. And because these are all, just yesterday, I had a couple, a lady come to my room. She's 42. She has a 17-year-old girl. And she said if she's been trying to conceive for like 13 years now, it's not coming. If she had terminated that pregnancy, that would have been probably the end of her. And so these are some of the things we can. Of course, we want to look at lifestyle, diet. Diet is very important. We want to encourage eating. I always say when it comes to diet and fertility, that the more colorful your food is, the better.
Okay.
My friend Anna Wusu, he will tell you. Then the more colorful your food is, add a little green, a little yellow, a little um, brown, a little white. We love the whites. We love
I
the whites
know.
so much, but we are not careful. The whites are the ones that will also take us to our grave too early,
Yeah.
and that can also have effect on our ability to conceive. And so we want to do diet. Of course, exercise is important, especially for the men. Then, for the men, one of the other things we want to do is you want to, as much as possible, desist from heat around your perineal area. The testis, it's sitting outside the body for a reason. The testis is sitting, the scrotum was made to stay out so that it can house the testis from the body, because the body temperature is too hot for the testis. Yes, you need a lower temperature to be able to produce optimally the
Okay.
sperms. And so if you keep the perineal area too hot for too long,
Hello. Looks like he's gone off again. Okay. So, Amen. He was talking to you. Okay, you're back. That's okay.
Okay, so yes, so one of the key thing to avoid is avoid heat. Those who use motor, I mean, I'm talking about motorbikes, sitting on it for very long distances. The heat around the perineal area can be high, and it can affect that. And then, if there are infections, you want to treat it appropriately. Some people get infected, both men and women, and they just go around get anything at all because my friend says this works, and then they take and they are off, or sometimes they don't even treat it at all. These can all affect your ability to conceive, and so you should deal with them appropriately. So I think in summary, when it comes to prevention, avoid infections, especially sexually transmitted infections, treat them and treat them well where necessary. You want to have a good lifestyle, diet, and then exercise, both the man and the woman, not just the woman too. You should all exercise. Of course, the men, you want to avoid this. A lot of the time, the men, the young men, when they want to be muscular, and so they are taking in testosterone and some of these anabolic steroids. They are very, very dangerous for sperms. And you realize when you go among the macho men, infertility is very, very high amongst them,
I see.
especially those who use anabolic steroids. If you haven't had, so you may have a very muscular, well-built man, but his sperms are like a toddler. The reason because of the use of the anabolic steroids. Not just if you are just exercising, that is fine. But once they start introducing these steroids and especially testosterone, it affects their sperm production.
Okay.
Of course, there are some diseases. If you have diabetes, you want to treat it and treat it well, and then other things. Yeah.
Okay.
So
So
that has to
before
do
we
with the prevention. Yeah. Go ahead.
okay, before we go on to the interventions, there's this question that sometimes comes up, that does the size of the man's genitalia determine their fertility?
Okay. Okay. So the obvious answer is no.
Okay.
And you realize that I told you about the requirements for the requirements for conception.
Yes.
What you need is a potent sperm, not a potent manhood. I have. Of course,
Okay.
the penis should be big enough to be able to penetrate the woman. It should be okay to be able to ejaculate. And then what comes out should be good enough, meet minimum criteria. It's not so much about the size of the penis, no.
Okay. So in the case where, because sometimes you hear stories like that where a man's penis is a bit too small, will that be a reason for which their partner can't conceive?
Once they can penetrate, it should not be a problem.
Okay. So the point
Once
is
it
that it
can
should be able to
enter,
penetrate.
penetrate, yes, that's the
Okay.
most important.
Okay.
Once it can, it doesn't have to go all the way to hit the surface, but once it can penetrate, that should be good enough.
Okay. Okay. All right. So now we can talk about the interventions to
Intervention,
help
so
manage infertility.
infertility. Okay, so
Yeah.
um, infertility management is very dicey thing. The challenge is that it usually requires a lot of patience. It usually requires a lot of investment. And so I saw a couple yesterday. They have been coming to see me for a year. And yesterday they came and gave me the good news. I scanned and they were pregnant. It's been 1 year. They have come, they've done so many things. 1 year for some people is like nothing. Some people have been coming for years. It requires patience and it requires a lot of dedication. So a lot of the time you get people, you come in, seek help for 2 months, 3 months, and then you vanish for 2 years. Then you start again, 5 months, you get tired. Yeah. All of those do not get good results.
Okay.
Okay. Now, the interventions depend on the causes. Yes, interventions depend on the causes, and so I would put them in very broad causes, and then we can deal with them. One of
Okay.
the commonest cause of infertility is anovulation, where the woman is not ovulating or releasing eggs.
I
And
see.
normally, what we do there is to be able to pick up why she is not releasing eggs. And once we're able to pick it up, we can give intervention. Sometimes it's just drugs that you would take.
Okay.
If you take things like polycystic ovarian syndrome, there are very common medications that you can give that would help you release eggs. Sometimes you may need drugs to treat certain conditions, like if your prolactin is high, you may need drugs to bring it down. If your thyroid function is abnormal, you may need drugs to correct it. And all of those will encourage you to be able to ovulate, to help you to conceive. So that is one big chunk. We're still on the ovulation bit. Occasionally, you may do um, some procedure, maybe in addition to just oral medication, you may want to take some injections
Okay.
that will help produce more eggs, and that can also help you to ovulate. I'll come to the bigger ones like IUI, IVF, and all at the end. So let me
Okay.
not bring it in at this point. Okay. Then, when it comes to from the ovary, when it comes to things like the tube, if one tube is blocked, it shouldn't be a problem. Maybe it may delay a bit, but you should be able to get pregnant from the other tube. But if both tubes are blocked, then obviously, and it cannot be unblocked. Usually, sometimes it is just some small fibrinoid, something that is stuck there. And so when you push, you may be able to push the dye or the saline through, and the person may be able to conceive. But if it is indeed blocked, then unless you resort to IVF, in vitro fertilization, and we can talk about in vitro fertilization as we get along, then so that is it for tuber blockage. Once both tubes are really blocked, the solution, we used to do tubal surgeries, but these days we don't do them any longer because the outcome is usually poor compared to IVF, and the cost is almost equally high. And so, and the risk of getting ectopic pregnancies, and also these days, even though it is there, tubal surgery to correct tubal problems, it's not something we do so commonly, but it is also there. It can be explored. Then, when there are
Sorry, before you
problems,
go on, what causes the tubes to block?
okay, so I come back again. I have mentioned that the main causes of the tube to block is infection,
Yes.
chlamydia, gonorrhea, and then all the other sexually transmitted infections, as well as pelvic infections, PID. PID. Those are over 90% of the tuber blockage we have in Africa, sub-Saharan Africa, is from these diseases.
Okay.
Also, we can have things like fibroids. If you have fibroids stuck in the wrong place, close to the tube, it can block the tube. Adenomyosis, not commonly, but occasionally can block the tubes. We have things like pelvic surgeries. If you've had surgeries, appendix that ruptured, typhoid and all that ruptured, and then it can cause a lot of adhesions, and then it can also block the tube. So those are the things that bring tuber blockage. And like I said, if the tube is indeed blocked, then it is a permanent structure, and for that reason, you will not be able to conceive unless you consider IVF.
Okay. All right. Please go on.
Okay. So yes, now for the other interventions. So I've spoken about now when it comes to uterine diseases, disease within the womb, things like uterine fibroids. Uterine fibroids are very notorious in our So when you scan um, women in their reproductive age, especially in their 30s, when you scan 10, between 3 to 4 of them, you may find fibroids. And so it is very, very common. We live with it. Maybe small, some are big. No, depending on the location, the size of the fibroids, it may affect your ability to conceive. And we've had several patients who have tried many times. Once we remove the fibroids, they're able to get pregnant. But you
Okay.
need to know that the fibroid surgery can potentially also affect your ability to conceive because it can affect the inside of the womb or the tube. So we encourage that these surgeries are done in the right hands. You know, now everybody in every ghetto says he's doing this surgery or that. If you don't get the right people, then you would end up with problems. But sometimes some fibroids are such that until you remove them, you would not be able to get pregnant. So those are the things. Then sometimes you can have diseases of the cervix, infections, blockage, no, and you would have to open it up. And if you're able to do that, you can get pregnant. And so that's disease of the cervix. Then outside of these, we also have if the male factor for the men, that too sometimes it has to do with hormone imbalance. And so if there are hormonal problems, thyroid, prolactin, or your female hormone and all, male hormone levels are low, you may need support in that vein. Then, additionally, for the men, sometimes you may also have to control certain chronic diseases, diabetes, and all of that. If you're able to control them, it improves. There are some supplements we can give to the men that also helps improve their sperm count. And occasionally, one thing we didn't talk about is what we call varicocele. Varicocele are some uh, blood vessels or veins that may grow around the testis or close to the testis. Because the temperature of blood in the body is hot, when that blood goes very close to the testis, it increases the temperature around the testis. And when that happens, I told you that the sperm production needs a cooler
Yeah.
body. It doesn't go and put ice packs around your testes to not improve. It needs a cooler environment to be able to do. And so you want to, so if that happens, then you may need surgery to remove those veins from there, and it will improve your problem. Now, occasionally, if you have what we call azoospermia, and or there is some blockage within the male genitalia, so that the sperms cannot reach the outside or may go back, then you may do surgery to reconnect the obstruction. Or alternatively, we can go into the testis and then harvest the sperms and use it
Okay.
for IVF or what we call intra ICSI. So you can actually go cut into the sperm, or sometimes we don't even cut, we aspirate the sperms from the testis itself. So it doesn't have to traverse the whole penis and to come out, but we draw it out from there. And whatever we get, we can use it for either IVF or ICSI. So that has to do with male interventions. And
So you
then
said
there are
IVF or what?
ICSI, ICSI, intracytoplasmic sperm injection.
Okay.
That's big profile. I'll explain.
Okay. Please do.
Okay. Okay. So now there are other forms of medically assisted conception techniques that are available, and that's where fertility specialists we I mean, pride ourselves a lot more because with that, so many people are able to conceive who hitherto may be unable to conceive. And one of them is IUI. IUI is basic. IUI, what some call artificial insemination. IUI is basic. Usually, if you have couples with very mild male factor, so the woman has very good female factor, everything is fine, at least one tube is okay, and all of that, but still pregnancy is not happening. maybe the sperm count is a little low, you can actually do IUI. Or for unexplained infertility, you can also do IUI. And IUI, basically what we do is that we give medications, could be oral or injection, or we monitor the woman to be able to release an egg. Once the woman is able to release the egg or ovulate, then we get the man to produce the sperms. Once the man produces the sperm, we treat it in the lab. We wash it, we add medications and all to improve the quality and the movement of the sperm. We select the good
Okay.
ones. And then we introduce it back into the woman, but transvaginally, just a small catheter. We push it back in there. Then now what we have done is that instead of the sperm that would have to move all the way from the vagina through all the hostile environment, because if the sperm stay too long within the vagina itself, they die. But they're
Yeah.
able to go through, and then they get through the cervix. You bypass all of that and you deposit right close to where the tubal orifice is, and then the sperms can then pass through and go. And that shortens the distance and improves your chances of getting pregnant. That is IUI. Then we go to much higher forms, which we call like IVF. IVF, IVF is this is how IVF works. Basically, what we do is that we give you medications, usually injections, to the woman to help recruit more eggs. And then we help the eggs to all develop. Instead of normally you would have only one, maybe two eggs develop. But this time we give injections and then you have so many of the eggs develop at the same time. Then under ultrasound guidance in the theater, we suck out all of the eggs. We don't cut anywhere. It is just an injection and we draw out the eggs. Once we're able to pick up the eggs from the fluid, we then take the sperms and then we treat it and then we mix the eggs and the sperm in the test tube in the lab. And then fertilization that was supposed to happen in the tube for the woman, female, would then happen in the test tube in the lab under certain controlled environment. What we do is we simulate the natural environment in the lab. So fertilization will then happen. We allow it to grow for between 2 and 6 days. And once it gets to a certain level, we take those babies that are formed and we introduce it back into, or those embryos, and we introduce it back into the woman and give medication so that the person, if it's able to take, the person will then be able to get pregnant. That is what we call
Okay.
IVF, in vitro fertilization. The little
Sorry. Hopefully he'll be back soon. Welcome back.
Okay, sorry. Yeah, so after we have gotten the eggs, what we then do is that we pick one sperm and then we inject it directly into the egg. Instead of mixing them up, we pick one sperm. So if you even have, I remember I had a client, we struggled that we could only get 3 sperms. Only 3 sperm. Meanwhile, when normal when you ejaculate, some people can produce as many as 200 million sperms. You can put, some people can produce as much as 200 million sperms. But this one we could only get 3 sperms. And those 3 sperms, we injected them into 3 eggs. And one was able to develop further and we
Okay.
introduced it. And she's pregnant. She's about 38, 37 weeks now, as we speak. So these are all possible. These are all possible, especially when the male is not producing sperms or the sperms do not have the semen do not have any sperms in it. We can go
Yeah.
into the testes and whatever sperm we get, we inject it into the egg directly. That is what we call ICSI. There
Okay.
are other forms. So, I mean, I have people coming at 48 years 48 years, we check there is, I mean, a woman, 48 years, we check there is no egg, no egg at all. There is a possibility of using donor eggs.
Okay.
The oldest client I have personally had delivered at 53, almost a few days short of her 54th age. And so even that age, some people are still able to conceive, but it is, you would have to use donor eggs because most of those very, very advanced, you may not be able to get eggs. But it's all based on the assessment that is done. It's individualized. Some, it varies from person to person. And so for some, you may need donor eggs, may not even be for only the elderly. There are some young people, their eggs may not be of good quality, may not be working. You can get donor eggs. There are also sperms that are banned. So if you have difficulty with sperms, you can actually use donor sperms as well. So all those possibilities are there. There is also the possibility of even surrogate. In the right hands, you can get a very good surrogate services. I remember I had a client who was born, who came from Canada, was born. She has ovaries and eggs, but she has no uterus. She was born without a uterus. So what we did was, I hope you can hear me.
Yes.
Yes. So what we did was that we retrieved her eggs and then used her partner's sperm to fertilize. Then somebody carried for her, and after 9 months, she had her baby. Came for her baby. Once you go through the right legal proceedings, all of those services are available in the country, and you can get them. And yeah. Yeah,
Okay.
so those are some of the interventions that we have other interventions that may be to be able to understand better things like laparoscopy, HSG, and all these are all done to investigate. We didn't tackle investigation of the infertile couple, but those are some of the things that we can. If you want, we could look at that as well.
Yes, please. Please go on.
Okay, okay. I mean, so maybe just a quick one. So normally, if you have infertility and you come see your doctor, there are basic things that your doctor should be able to do for you. Your doctor, after listening to you, should be able to check the man, if by way of ejaculation, by way of erection and all, if it is happening, that you can just talk to them, you'll be able to know. And then additionally, you want to do sperm analysis. And based on the result of the sperm analysis, you also want to do culture to pick up infections. Then you may do, if it is bad, you may need to do a scan or may need to do some hormones for the man. And
Okay.
all these, based on what you are finding, you grade upwards. Sometimes you may actually need to go into the testis and take some of the tissue to see if there is still sperm there or not. So those are all things that could be done for the man.
Okay.
For the woman, you may want to basic have a scan to look at your womb. Are there fibroids? Are there other diseases there? And all that is affecting your ability to conceive. You may want to check your tubes. And to check your tubes now, we have what we call HSG. HSG looks at the inside of the womb and the tubes. We also have a saline infusion sonohysteroscopy, SIS or SHS. And those ones, it's not senior high school. It's saline, saline infusion hysterosalpingogram, where you look at the inside of the womb to pick up any disease, as well as the tubes to pick up any disease. So that can be done. Then there are basic things. Check for infections, check for diabetes, check for your thyroid disease, any hormones. You want to look at your hormones. Some imbalance in the hormones you want to. Some people may actually need to have a transvaginal scan and not just an abdominal scan. Because the transvaginal is able to look at the womb better, look at the ovaries, you can count your eggs and all from the transvaginal scan. And so these are some of the investigations that are done. For some, you may want to look at your egg reserve. And those are all part of the hormone profile or the hormone panel that is done. A few people may need more bigger things like do laparoscopy to where it's a pinhole surgery kind of to look inside and understand things better.
Okay.
Some will need what we call hysteroscopy, that is looking inside the womb to also understand the inside of the womb better. You introduce telescopes into the womb and then you distend it with fluid and then you can see there are diseases inside the womb. So these are all possibilities that you may have as you go along.
Okay. Thank you so much. You said a lot now, so I think we'll go and see if there are any questions, and then we'll continue from there.
Okay.
Okay, I think you've answered this one, but I'll still read it. The person is saying, my question is, can someone with PCOS have fertility issues? And also, if able to conceive, give birth to a normal baby?
Okay. So PCOS is a major issue all around, and especially for us, it is very common. It's one of the leading causes of anovulation, that is inability to release eggs, and subsequently a leading cause of infertility. PCOS has other problems, but we can't talk about them now. We're just looking at the fertility component of PCOS. And obviously, the answer is yes, it can affect your ability to conceive. It doesn't mean that if you have PCOS, you cannot have a child. Yes. Some people without any help, we are able to conceive naturally. But for most of them, you may need a little support. And so if you know you have PCOS, what you should do is as soon as you are ready to want to have a child, you want to seek help. For those cases, you don't even need to wait for the 6 months or the 1 year. You want to seek help. And there are very basic things that can be done to support you. And so PCOS, yes. Now, if you get pregnant and deliver, will you have a normal child? Yes. Usually, your risk of getting abnormality does not significantly increase far or above what we have for the general population.
Okay. Thank you. The next one says, is there a position one has to be in so as to get pregnant during sex?
Okay, so that's a very interesting but common question we come across every now and then. Should I keep my legs in the sky? Should I hang my legs up? Or I should bend my head down? Or truth is that generally speaking, no. The key thing is, you see, if you look at the way the female genitalia is, when you are standing, it actually bends forward like this. It doesn't stand like this to seep out. And so, strictly speaking, no. And for most people, you don't lifting the leg of your bed, turning to your side, bringing your leg down, your head down, turning to the back or the front, whatever it is. Once the sperms are properly deposited in the vagina, the good quality sperms will be able to swim up and then enter through the hostile cervix to be able to enter the womb. If the sperms there are problems with the sperms, definitely you would have difficulty conceiving. But once the quality meets the minimum criteria, it shouldn't be a big problem. A common question that arises from this is that, whenever we have sex, the sperm seep out. The sperm. I'm looking for one person who has, one woman who has had sex. You had enough sperms deposited in the vagina and nothing seeped out. It's usually most people will complain when they have difficulty with getting pregnant. That notwithstanding, there are a few people with problems where the cervix is stenosed or both tubes are blocked. And then you tend to have maybe significant, you have deposited quite a lot of semen in there, but you have significant quantities seep out. All you need to know is to be able to assess your womb, assess the tubes, assess the endometrium, the cervix, and all. If it is fine, I do not think that is a problem. Not at all. For almost everyone who has sex, you would have some sperms come out. Unless the sperm quantity or the semen quantity that was deposited was very small. So it was not enough to fill and to have some trickle downwards.
Okay. I think for now, these are the only. Okay, there's one. The person saying, how long after fibroid surgery can one conceive, all things being equal?
Okay. So all things being equal, we encourage that you attempt to conceive after 6 months. Occasionally, it depends also on the type of fibroid surgery that you do. For some people, even 6 months may not be good enough to heal. For some people, if it's just outside and all, usually 4 months will suffice. But generally, as a rule of thumb, we say that 6 months is good enough for most people.
Okay. All right. For now, it's the last one. So I'll ask, when you were talking about career women and they freezing their eggs, because this is a Christian program, I want you to talk about the God factor here. This thing has come up a few times, and people say you're sort of taking things into your own hands, not allowing God to, should I say, intervene, or for him to have his way. You get the question.
Yeah, I get a question, and it's a fair question. It's a fair question to ask. Are we playing God? Are we playing God? And it's a question I have asked myself many times. I had to think through many times. But then, let me take, for instance, I would come directly to yours when it comes to the age and egg freezing. But let me come to something very peculiar. For instance, use of donor eggs. Donor eggs. So you have a couple that have come to me, and we have checked. Obviously, naturally, they will not be able to conceive. But my pastor says for us as a church, we do not believe in third party. We don't believe in donations. Once it's not coming from me, you should accept your fate. I have seen marriages break down. Very audacious men. People who are really prayerful and powerful. Their mothers get involved in the subject, and they start treating their wives as dust, and in no time the marriage break down. Why? Because of infertility. I've seen a woman commit suicide because of infertility. Commit suicide once. So you look at all of these things, and then you ask yourself, so if there is help in a bit of a donor X, for instance, what really is wrong? Is it wrong for me to accept, for instance, a child adoption? If we can accept a child adopted into my home, why cannot I not adopt egg, for instance, to be able to have a baby? Take, for instance, if my blood level is 4, is very low, and I can accept blood donation to live, how can I not accept egg donation, for instance, to be able to have a child that will bring joy and happiness to my home. And so these are all ethical things. They are spiritual things you should think about. I cannot profile my a solution or give my own view for people to follow by all means. But as a Christian, I have searched through the scriptures, and I do not think God is against these. Of course, why there are some people who come in with very trivial reasons, and sometimes you'll be carrying it a little beyond. I mean, very, very trivial. I mean, you have a husband, you have a man who is ready, you want, instead of getting married, for some very trivial things you do not want to. And so in all of these things is the intention. Remember the Bible talk about as it Onan or one person who did.
Sorry, but he's off again. Hello?
Yeah, sorry.
Sorry. Yeah.
And yes,
You're talking
and
about
you
Onan.
remember that, and Bible says that God killed him. God killed him not because of the fact that he pulled out, which we call coitus interruptus, but he was killed because of his intentions. His intention was so that he will not get pregnant, he will not impregnate the woman to make a name for his brother. And so,
Yeah.
in all of this, think about your perceptions. And I feel if you think you are right with God and you are doing it for a genuine cause, why not? There is help for you, and you can embrace it. And once you seek the right help, you can have it. We've seen women from our churches go into some malam or some fetish priest for bathing. They end up in the beds of these fetish priests and these these criminal people. Recently, they were in the news. We have somebody who in a day could have sex with as many as 5, 6, 7, even 10 women, all in the name of getting them pregnant. And some of them may portray themselves as men of God, but they really are beasts. Beasts. Yeah, they are really, really wolves that are mixing with the sheep. And I believe that in the end, God will fish them out and deal with them. But
Yeah.
child of God, woman of God, seek help. And I believe that in the right hands, you get the right help, and God will bring you joy once again to your home. Yeah, so I think you should not unduly use very flimsy reasons to avoid having a home early. But if there is a genuine need, why not? Maybe there is nobody there now. You can save it for the future. You get married. If so, you have frozen eggs. You marry even at 40, 2 years, nothing has happened. There are eggs that are frozen there for you, which you can use once you can afford the services. And it is your own. I do not think there is really anything wrong with it. And you really are not you cannot play God. You know how big God is. Have you heard him? You know how big he is, how mighty and gigantic. Who are we, mere humans, mere mortal, to try to be like God? No. If it is against his will, I have seen people who have done IVF 7 times, 8 times, and has not worked. They have
Yeah.
even used donor, it hasn't worked. They have even used surrogate for somebody to carry for them, it hasn't
Hasn't
worked.
worked.
Who are you to say you play God? But if it is in his will, when everything seems odd and off target, when it seems that it is not working, that is when he makes himself strong and he makes a way. He said he will make a way where there seemed to be no way. So, sister who is struggling, seek help. Don't be deceived. Don't be deceived. Don't say this. What is God telling you as an individual? Don't be deceived by certain doctrines and certain things that may end up misleading people. Once you are at peace with God, by all means, don't go. There are a lot of things like IUI we are talking about can easily be done, but there are a lot of women who end up sleeping with other people to be able to get pregnant for their husbands,
Yeah.
and their husbands will never know.
Hmm.
And I'm sure we'll never know. See, and these are things people are doing in the church. I
Yeah.
remember I've had clients who come, oh, we have 2 children, but we check the man's sperm semen, and there is zero sperms.
Zero sperm.
Eh,
Hmm.
there is, yes, we call it azoospermia. It is zero, but they are there. So if you have the right help with your azoospermia, you can have the right things done and you'll be able to get pregnant. Why would you deny yourself this? Because not me, I cannot play God. If you want me to tell you, I can never play God. But I can give you services based on what God has blessed me with, the knowledge I have learned, which I have invested, moved in, and I can do everything possible. In the end, it is God who gives children, and for those He will give to, you will definitely have it.
So I'm just hoping that um, the fact that eggs can be frozen for later doesn't um, wrongly influence women coming up,
People to, yeah,
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 to take selfish decisions.
yeah. So
Like you
I
said,
agree with
your
you.
motive
Yeah.
is very important. If anything like that should happen, then it should be because God has convicted you to do that, not because, oh, I don't want my body to sag, or I have this ahead of
Beautiful.
me, so I'm going to hold on, even when God is saying, oh, it's time. Stuff like that.
I mean, Abby, I think you've hit the nail right on the head, and the motive is so important. And you should talk to God and then listen to Him. He talks back to us. If you really are convinced, it's in His will. Why not? But um, all I am saying is don't get unduly influenced by people whom themselves do not understand what God is saying. Seek Him for yourself, speak to Him, and He would
Yeah.
let you know. But I do not think the process in itself is wrong. No.
Yeah. Yeah. Okay. There are some questions. It says, is it possible to have a gestational sac without an embryo during pregnancy?
Yeah, so we usually will call it anembryonic gestation or missed abortion. Normally, when you get pregnant, the inner layer of the womb thickens to start with. Then, with time, you would have a small gestational sac begin to appear in the womb. Once the sac begins to appear, it gets to a point then the embryo then forms within the sac. But sometimes you can have the sac, but there is nothing in. And you give it time, you monitor, and it still persistently stays as a sac alone. If that happens, then you say you have a missed abortion. Some people, you start losing all the symptoms of pregnancy. With time, you don't even feel pregnant any longer. And those ones, you would have to get the sac out and then start again from there.
Okay. Okay. Thank you. The next one says, are there medications to help conceive twins aside IVF?
Well, the strongest risk factor for getting twins is family history.
Yeah.
If you have a family history, that is your strongest um, possibility of being able to get twins. And but there are some drugs that can help increase the number of eggs you produce, and that's may increase your chances of getting twins. But it's not magical.
Okay. Okay. All right. The next one says for those whose cycle is 32 to 35 days, when do the when does the ovulation start?
Yes, so like I said, ovulation typically happens around 14 days from your next
Next.
cycle.
Yeah.
Yeah, so let's say if you have a 35-day cycle, so it means that around actually to go all the way to about day 2021. See, so if you were looking at day 14 for such a person, you miss it. If your cycle is 32 days, then it means that it may go all the way to, let's say, about day 18, thereabouts. And so you need to know that it is about 14 days to your next cycle, and you can use that to work out.
So
Fortunately,
how
now we also have ovulation test kits that are available. It works like a pregnancy test, which you can do usually from after your menses. You test every day until it comes positive. And
okay.
usually I recommend it to those who have long distance and all. So your partner is in Kumasi, you are here. You test, and then once it tests positive, you go and look for the next bus to Kumasi or the next.
Quickly.
Like you can meet around you can meet in the middle between Kumasi and Accra. Then you are fine. So that's also one of the possibilities that you can use.
How long does ovulation last? Does it vary with each person?
So ovulation, it's a complex process, but typically the egg when it's released may last for just about 24 hours. Typically, sometimes even less than that. So the most crucial period is when that egg is waiting. But fortunately, men always wait for women. So if you have the sperms deposited before the egg is released, then by the time the egg is released, there is already sperm in handy. So let's say you have sex 2 days, 3 days prior to your ovulation, or a day prior to your ovulation. The sperms can actually stay for up to 5 days. It's much stronger in the first 3 days, and so the sperms can go wait for it. So I always encourage that you try and hit it before your date of ovulation, and not necessarily targeting the ovulation itself, else you may miss it.
Okay. Okay. That's really important to note. Okay. The next one says, okay, it's rather a comment. Dr. Amoateng is just too blessed with correct hands for anything, and we are grateful to have you. That's from Cynthia. There's another
Thank you,
question.
Cynthia.
Why do they use your last menses to calculate your weeks of pregnancy? Hello.
Can you hear me? Okay.
Yeah, I can hear you. Did you hear the
Yes.
question?
Yes, I got it. So I was describing we need a fixed period. It is very difficult to tell when you got pregnant. In the middle. Oh, is it that particular? Because it's the hair. So usually we use a fixed period to be able to estimate the exact date. And for most people, of course, the first day of your menses, that is spectacular, and it doesn't vary. You would have it. You know the date, and so it is easy to work with. And a lot of research has gone into the calculations to be able to work out the date. And so the date is almost always started from the first day of your last menses. And to tell the truth, that is actually when recruitment of the eggs. In fact, recruitment of the eggs start begin from there. But that is when the growth of the eggs starts, basically from the first day of your last menses. By the middle of your cycle, the egg is mature and fertilization
Mm.
is happening, and then baby continue to grow from there. So if you start counting from the middle, you would have missed the growth of the eggs. But by and large, the main reason is so that we can have a fixed point where everybody internationally, worldwide, will be able to refer to, and it's easy to calculate instead of ovulation or when the baby was actually formed.
Okay. Thank you so much. Our time is up. So unfortunately, we would have to end the conversation here. But we've learned a lot. Um, Let me try and recap some of the things I can remember. I'll touch mainly on what we can do to avoid infertility. And for me, the important things are eating well, exercising, um, practicing safe sex if you have to have sex. I mean, the ideal is to abstain, but if it happens, you need to protect yourself. And if it's within your power, I should say, don't wait till you're too old, especially for the women, to get married and to have children. And then for the men as well, don't wear clothes or do things that introduce too much heat to your scrotum. You know, I think so far those are the things that come to mind. Dr. Amoateng has said a lot to us, and I believe that it's been very helpful. And we'll all go back and make educate, how do you say, informed decisions. Yeah, so that our bodies can be healthy enough to be able to procreate. All right. Do you have any final words for us before we close the curtain, Dr. Martin?
Okay, so thank you, Abby, and then your team for having me. Um, Children are beautiful. It's a delight. It's a blessing from God to have children. And by all means, we encourage all men and women to have as many as possible you can take care of. But if there are problems, seek help. Um, Live healthy. It's my prayer that as we end this session, the Lord God Almighty will open the fruit of the womb to anyone listening to us who desire it.
Amen.
I pray that God will visit somebody tonight, that the miracle of our time will come. It comes in diverse ways, but the God of heaven will send angels to visit and minister to you. I pray that as many
Amen.
as have had sleepless nights, have had troubled souls because of the problem of infertility, they would seek the solution they desire, and God will help them. We are available, as I said. Um, there, once you go to the
Hello. Hello. Hello.
Yeah, all my prayer
So
went, but
sir,
God had it.
yes, yes,
I
yes.
don't know what happened. My regular fiber,
Hmm.
I don't know, some way, somehow, the whole area has gone off. So I had to get some.
Oh,
This MTN turbo net, sometimes it can be.
yeah. Hmm.
I probably
That's
should
all
have
right.
gone home. I have fiber at home, it would have been better. But it's okay.
Hmm. Yeah, it's all well and good.
Yeah, it's okay.
So thank you so much, and amen to the prayer. We thank God that He's sovereign and He will act accordingly.
Yeah, yeah.
Amen.
Amen.
Okay, and thank you too very much for coming. God bless you, and continue to use you to help impact the lives of humanity and give you the wisdom as the years go by to come up with even better interventions to help people dealing with infertility. God bless you so much.
God bless you too. Amen. God bless you too. So maybe
Amen.
another time. Bye bye.
Yes, yes, we'll be in touch. Thank you. All right. This has been the IMANI Reveals show where we speak, we are real so that we can live. And today we've talked about infertility. I know that definitely all the things that have been said we'll not forget and we'll make good use of them so that truly we can live the abundant life that Christ has given to us. Before we go, I want to remind us again, if you haven't subscribed, just go to the IMANI Reveals show on YouTube, subscribe, and then send the link to anybody else you think will benefit from our discussions. Thank you so much for coming, and God willing, we'll see you next Monday.